Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when you cannot maintain a 2-meter distance from others. I will now report our current case counts. There are 122,872 confirmed cases of COVID-19 in Canada and 40,745 cases in Ontario. Chatham-Kent has 359 cases and Sarnia-Lambton has reported 336 cases. Michigan now has 93,185 cases, with 13,241 being in Detroit. Today we are reporting 2,449 cases of COVID-19 in our community, an increase of 25 cases from yesterday. 21 work in the agri-farm sector, 3 are residents in a retirement home, and 1 is still being investigated. 112 of our cases are currently active and are being followed by our health unit. 2,266 people have now resolved, 99 people are self-isolating, and 6 people are in hospital. 27% of our cases are between the ages of 20 and 29 years, and 24% are between the ages of 30 and 39 years. 65% are male and 35% are female. Our community has lost 71 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. 2 retirement homes are currently experiencing a COVID outbreak. In addition, there are currently 4 workplace outbreaks. 3 are in the sector and 1 in the manufacturing sector. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain, if you're feeling confused or losing consciousness. Windsor-Essex has 2 COVID assessment and testing centers, Erie Shores Healthcare in Leamington, and Windsor Regional Hospital Olette Campus. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must remain isolated pending your test results. To check your results, please go to wechu.org and click View Your Results to access the online test result portal. If you're unable to view your results, please contact the assessment center or healthcare provider that initiated your test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, everyone, and thank you for joining us again. COVID-19 pandemic directly affected millions of people worldwide and caused widespread health, economic, and societal impacts. Among the affected countries, the provincial and federal response in Canada was probably among the best in reducing the morbidity and mortality across Canada. As a nation, we are now focused on the recovery while maintaining many of the same public health measures. Some public health measures have been proven to be effective time and time again in preventing the spread of COVID-19. Among the many public health measures, locally, mandatory face covering in commercial establishment was identified as an additional measure to protect our community. Since the beginning of the pandemic, there was a lot of discussion on the appropriate use of face coverings. I just want to remind everyone that face covering is not the only public health measure that we need to protect ourselves. There are other public health measures that you need to take in conjunction with the face covering to keep everyone safe. Using my authority under the Health Promotion and Protection Act, I issued a mandatory face covering order in commercial establishments on June the 26th. Since this order came into effect, the health unit staff have responded to hundreds of complaints, most of which were responded to in person at the business. A dedicated staff member and mass complaint hotline was created to help answer questions, triage complaints to the appropriate enforcement officer, and systematically address email and social media messages. We have worked with countless businesses across the region, earlier in the response to complaints or through proactive inspection over the past month and a half. The health unit has supported the community by ensuring the measures are being followed and supported its businesses by walking them through complicated enforcement scenarios using an educational-based approach. The measures put in place through these orders were based on the best available evidence and in consideration of promising practices from across the province and the entire country. We firmly believe that these type of measures and every resident's sacrifice and diligence in following them has had a profound impact in lowering our cases of community spread to the point that they are at today. For this reason, the Windsor-Essex County Health Unit is encouraged to see the actions of our partners, the municipalities, in continuing to build upon the existing measures to complement the foundational order that was put in place at the end of June. While each municipality will be primarily responsible for enforcement of their own measures, the Windsor-Essex County Health Unit will continue to follow up on complaints related to commercial businesses in non-compliance with the original Section 22 order. We will continue to work with our local municipality and local law enforcement agencies to ensure that all these complaints are addressed and appropriate agencies taking the lead in taking further actions. For Windsor-Essex, these complaints can be made by calling the Windsor-Essex County Health Unit Mask Hotline at 519-258-2146, extension 4510. Thank you.
The conference is now unmuted.
We will now take questions from the media. We'll start with Blackburn.
Yes, just regarding the new cases, was the 21, is that from a new farm? Because I did notice there was one additional workplace outbreak. So is that, are they all from one farm?
So last week we reported a couple of new cases in farms, and the increase of the cases announced today were contacts of that particular farm. So that farm is now on outbreak and is considered a new farm in outbreak.
Okay, and so same for the retirement residents. Are they from a new place, or are these connected to other cases?
So we have 2 retirement homes in outbreak, and the cases announced today are related to one of the homes that is currently in outbreak.
Thank you.
Any questions from Windsor Star?
Yes, good morning. Dr. Ahmed, the retirement home experiencing now cases among residents, could they have done anything to prevent this? I know that some public health measures were supposed to prevent spread within retirement homes, even if one person were to get sick.
I think it definitely triggers our communication with the retirement home. Our team worked with them, and then we identify any deficiencies, any gaps in their measures that can be strengthened or that we can support. There's obviously, when you have a case and if all those measures are followed, it's helpful to prevent any further spread in the cases at these facilities. So we will be having those critical analysis, having those conversations with the retirement home and the long-term care home wherever these cases are. We'll work with them. We'll ensure that all those IPAC measures are being followed, monitored, audited, and they have a learning experience from them, and ensure that they have good, strong control measures in place to prevent any further transmission and even to reintroduce any new cases in these facilities. So all those things are definitely something that our staff are taking that as a priority, and all those investigation discussion are already triggered, even with one case. So hopefully with all of these measures, we will be able to identify any gaps or any practices that can be further improved and reinforced to keep everyone safe.
And just remind us, in a situation like this, is this an opportunity for the entire population of residents at that facility to be retested?
So it really depends on the investigation. Previously, there were some recommendation to test the entire facility, and right now, I think it's more focused on the value and the utility of seeing like how the spread is happening. So if these cases are isolated, fairly restricted, and if all the masks and appropriate PPE is being used, all the cleaning that needs to happen, if that's happening, that shouldn't result in further transmission. In a situation where we can see that if it's a room where one person is a case and then the other person sharing the same room, if somehow they are showing symptoms, so which can be understandable because of the close contact or the nature of sharing the same airspace. But for others, if there is no evidence to suggest that where these new cases are, it may not trigger like a wide-scale intervention to suggest that. When our team is monitoring that, they are trying to get all the answers. So who's this case, who else they are coming in contact with, who the staff person are going into the room, either for cleaning or nursing staff who are going in to take care of this person, what's their schedule look like? Do they go after one room after the other, and are these rooms adjacent to each other? Are these rooms totally opposite end of the facility? What is happening in between? So there are a number of factors that we do take into consideration before some of these distinction is made, but definitely something that we always consider. If there's more need for expanded testing, we would do that. But knowing that each outbreak, each facility, each routine, the staff work habit and the staff work protocol can vary from home to home. So we cannot never say that, this is how we managed one home and this is how we should manage the other home as well. So I think there's always some variation to that.
Thank you, Doctor.
Any questions from CTV?
Yes, good morning, Doctor. How are you today?
I'm good. Bob, how are you?
Awesome. It's a beautiful day outside. Hey, I wanted to touch on the St. Clair student testing positive for COVID. Can you talk about the protocols that the college has put into place, which has helped you conclude that it's a low-risk situation?
So, so that's one of the things that we want to work with, and we have worked with many of the businesses as well to review their plans, to provide them with our feedback, and to provide them with the guidance. So many of the things that the college has put in place, we had the opportunity to work through their plan. We provided some of these recommendations. So among many other recommendations, it starts right from the time when the student is entering the facility, ensuring that they're screened appropriately. They have a policy and a process in place for anyone who is doing the screening and then connecting with the staff. Anyone who's screened positive, they are not allowed to enter the facility. Anyone who's screened negative, they are allowed to enter the facility and going into the classroom. Within the classroom, they have markings in place for appropriate seating of each student to maintain physical distancing. At the time when they're entering the facility and then going to their place where they're sitting, they have to wear a mask. They have to ensure that they are that they're not sick. They have number of hand washing station, alcohol-based hand sanitizer stations available to ensure that anyone who is coming into the building, they have the facility to continuously keep their hands free of germs if they have any germs that they're carrying. So it should prevent any type of environmental risk to any of the person who is there. At the time when they're working, they're keeping a track of everyone who's coming into the classroom, ensuring that everyone is aware. So based on all of that system in place or preventive measures in place, the individuals are deemed as at a low risk. So obviously there is some level of risk, but the risk is not high enough to say that all of these individuals need any additional intervention. So which was really helpful for us because that's where we like to see as the community that even if we have a case, there is no further transmission happening. So many of these plans are definitely helpful for not only for the institution, for the business, or anywhere else. It is also useful for the entire community. So we definitely supported and appreciated the time and effort that the college has put in to ensure the safety and well-being of their student. And I think that's a good reminder for everyone to make sure that you have good policies in place. We'll continue to monitor all those students. They will be doing their self-health assessment, and we'll be keeping a close eye on anyone if they develop any symptoms, which again, even though that they're low risk, we cannot say that there's no risk, there's always a risk. And based on that risk, if any of them develop any symptoms, they will be referred for testing, and then appropriate action will be taken by public health.
So those protocols in place pretty much helped you make the decision to self-monitor instead of self-isolate then, right?
That is correct, yes.
That's kind of surprised about that, but no, it's good. Does that give you confidence, I guess, moving forward? Because I've said this to many people throughout this. It's a learning process, this whole pandemic. So do you think that this gives you a little more confidence heading into, September, knowing that school and this is going to become a bigger scale, that if, people react the way they're supposed to react to the protocols in place, that things will work out and, it won't be as high risk as, parents are thinking it might be?
Well, I think this is, as you said, Bob, something that we continue to learn every day. Every day we learn something new. We learn better ways to deal with this virus. And what we can see is, yes, there is a case. And obviously, when you're thinking about a case, you have to think about their household contacts, which are obviously automatically are classified into high-risk contacts. And then you are thinking about any other type of contacts, which could be at the workplace, at the educational institution, and anywhere else. In this particular case, we felt that at least the educational institute had all those good measures in place, which is definitely reassuring. But again, we'd like to see that, knock on wood, there is no further transmission or no one else is identified in the same classroom and giving us an indication that there may have some kind of possible transmission. If there is any evidence to suggest that there's a transmission happen in that particular classroom or in the institution, then we may have to look at their plans again, and we'll say, okay, how can we improve that plan further? Where was the gap? We will interview all these students to identify any potential risk that they have come into with the case, and if there's anything that we can improve their plan, we will definitely do that. But again, a lot of these plans are made based on what we know and based on the operational details and human behavior. We'll have to adapt, we'll have to change. So far, it's definitely reassuring that we have all these good plans in place, and that's what our team at Windsor-Essex County Health Unit have been working diligently with lots of businesses, many community partners, and all those work maybe most people will not be aware of or cannot see, but I can assure you that every day we are reviewing plans, we are working with our partners, we are supporting our community. Our staff is always out there. We want to support the community in the best possible way, and we'll continue to do that.
Please enter the conference PIN number.
Hello?
So,
Okay,
thank
sorry
you.
about that.
Any questions from Windsor?
Not at the moment. Thanks.
CBC?
Yes, good morning. Can you hear me okay? Sorry about that.
Yes.
So my line was a little down as well. Okay. Good morning, Dr. Ahmed. I wanted to ask you, obviously the plans that have been in place in St. Clair so far seem to be helpful with that transmission. How is it that 21 agri-farm workers were able to contract the virus, after those farms have been working with the health unit on their protocols? Any sort of insights there?
So I think one thing that I would like to clarify that maybe as we are working with the businesses, obviously the plan is their plan, and they are providing the information that we need to know. So we've been providing many of those recommendations. How it's actually implemented, obviously it's beyond our control. It's because it's their plan. We had the opportunity to have a number of conversations with St. Clair College with their plan, recognizing that that is probably one of the institution who receive international students, as well as many students coming into classrooms even before the schools open. So any kind of risks to the student and spread would be considered as high. The risk is considered high. So that's why we reviewed all those plans. When we're talking about these farms, obviously these farms have their plans, and the plan is only good when it's implemented and followed by everyone, including the workers, the employers, the administrators, and everyone else. When we're talking about health education, health literacy, and I think this is also something that we have addressed previously, that when we are talking about these temporary foreign workers, their health literacy, their health education, their understanding of COVID and what works, what doesn't work, what their obligation is, it's different than many other Canadians or people who are living in our region. Some of these temporary foreign workers, the country that they're coming from, their social norms, the way they communicate with each other, the way they behave socially, it's different. So having all those policies, adapting to those policies based on your unique people, I think that's also important. And I guess despite all those measures, we also have to recognize that when we're talking about these farm workers, many of them are household contacts. And I think that's the thing that I touched with the St. Clair College people as well. If you have household contacts, doesn't matter what you do, there automatically would be high risk contacts, and the likelihood of them contracting COVID would be significantly high. So there is this difference that when we're talking about where the workplace on its own or workplace policy is contributing to the spread versus their congregate living settings or their household spread that's happening. So I think when we're dealing with the farms, it's a little bit more complicated. Most of the transmission is happening at their bunkhouses, at their congregate living settings, rather than an actual workplace. And from an employer perspective, obviously the employer is doing everything at the workplace, as well as leaving some of these responsibilities to the workers, how they are behaving within their congregate living settings. Essentially, it's their house, so they're what they do is may not necessarily be as strong as what's happening at the workplace. So I hope that all these workplaces, once they have these cases, they're paying more attention to it, and they're doing more to prevent this from happening. When we are investigating, obviously we are touching on all those topics. What's happening, what the current practices are. Our inspectors, they are going in as well to do an investigation and to identify any other opportunities for infection prevention and control measures. So all of those work happens, but it's unfortunate that despite all of that, we still see some cases. And unfortunately, because of the congregate living settings, the numbers just basically multiply pretty quickly.
But Dr. Ahmed, I mean, it's a couple months into the pandemic now. You personally and other public health officials have said these accommodations are an issue. Isn't it disappointing to see that an outbreak like this would happen again after what we've already been through and what we know?
Well, I think a lot of that is, as I said, goes back to the whole concept of we as a human, we behave differently in different situations. Sometimes we are very diligent, we're very mindful of everything that we are doing, and other times if there are other things that are in our mind, we may not be following all those same public health measures or behaving in a way that is protective of others. So while I do feel that yes, we also have to be on top of doing everything, but we also recognize that it may not be possible at all times. The key piece is still is going back to these congregate living settings, and unless we actually change that And again, it's not a short-term solution that we can change it unless we change that. Every cases or every new case could trigger new cases or more cases. And I think that's where, when we are looking at fixing the problem, we'll have to address it in so many different ways. And definitely a long-term solution is needed. And, I'm sure that the various levels of government will work together, will provide our recommendations, our advices. There's lots of lessons learned. And we address the root cause of the problem. We need to work at different levels before a temporary foreign worker is coming to Canada, and when they're coming, what's happening, and then how they're staying, how they're living. There are a number of issues that I think that needs to be addressed, and hoping that all this learning will be utilized to help them and also keep our community safe.
Thank you, Dr. Ahmed.
Any questions from AM 800?
Dr. Ahmed, with the increase today in confirmed cases in the Acre farm sector, are you worried that that number could trend up, I guess, the rest of this week and moving forward?
Well, we have been in contact with the farm, and we are identifying any other potential cases or people who are at risk, and appropriate action. We will be taking appropriate actions to support the farm in containing these outbreak very quickly and prevent any further transmission. So all of those discussions will happen. At this time, I cannot say that there will be more cases or there will be less, but something that we are definitely keeping a close eye on, and we will be supporting the farm, and we'll be reporting it back to the community if there's any additional details that we can share.
I'm not sure if you can get into this, but can you tell us how many employees work at this farm, and if the farm owner is working with the health unit to resolve some issues, I guess?
Well, I can answer this latter part of the question is yes, we are working with the farm owner and their administration to support them in answering all the questions that you have asked. So our team is working with all those details that we have, and we'll continue to work with them. Both myself and Teresa, we typically take part in that conversation right from the beginning to show our commitment, and also to make sure that all these recommendations are followed, and ensuring that the farm also get our support. And they're also part of our business, just like any other businesses here in the region. And whatever we can do to support them without putting anyone's health at risk, whether we're talking about their own employees, whether we are talking about the community, all those discussions are top priority for me, my team. And as I've expressed it before, most of these farm owners, they are complying everything that we are asking them, and we hope that compliance will continue, and we help them contain the outbreak and prevent any risk to the community.
Thank you.
Any additional questions from Blackburn?
No, thank you.
Windsor Star?
No, thank you.
CTV?
No, thanks.
Windsorite?
No, thanks.
CBC?
No, thank you.
And AM 800?
Sorry, one more. Just going back to the college. Dr. Ahmed, you talked about the college has a plan. I know the University of Windsor for their fall semester is going to be online, but has the University of Windsor presented a plan to the college, and has to the health unit, has the health unit approved that plan?
Yeah, well, let me just change the language here, Rob. We don't approve their plan. We review their plan and we provide our feedback. And I think there's a difference that, we are not the approving authority for their plan. Their university approves that. And I don't know, I know for the school, it's the same that the Ministry of Education approved their plan. So I'm not sure if the university have their own body that approves their plan or not. But just want to be clear that we're not the one to approve their plan. We're there to consult. We are there to provide our feedback based on our expertise and all of those conversations. And again, it's not just one conversation. It's a series of conversation, presented their plan, we provided our feedback, and then we had some follow-up, and then they updated their plan, and then we followed up again. And so, and again, there are a number of team members involved in at our health unit, and there is a dedicated manager who is assigned to review most of these plans and then bring in the relevant expertise, whether we are talking about someone who needs an expertise from environmental health team, our vaccine team, our infectious disease team, and at different times it's myself, Teresa, and other members of our leadership team. So we have a good, strong process to review all those plans. And yes, we have reviewed University of Windsor's plan. We have reviewed St. Clair's College plan. We have reviewed many businesses plan. And I think we mentioned that the other day as well, that we continue to receive those requests to review plans. And we want to be out there for the community. And we've been working nonstop to make sure that the community gets the support. And despite many of their criticism, we're just moving along. We're supporting our community in the best possible way, and that's our job. We will do it. We haven't taken any break, and this is again a busy time for all of us, and we will continue to do the good work for the community.
Sorry, so just to clarify, so if an organization, a school board, a business presents their plan, and then the health unit provides their recommendation, these establishments, these organizations, should they ignore the recommendations from the health unit and continue with their original plan?
No, I'm not saying that. I'm saying that we are not the approving authority. Like 99% of the time, whatever recommendation we are providing, they're taking up on it. And again, a lot of those are operational details, which we not necessarily know their operation. They have the best idea of their operation. So we provide recommendations at a level that covers the critical public health pieces that we want them to cover. How they implement it, it's a lot of these are operational details that we are not even in a position to comment on it. We don't know their operation. We don't know their lay of the land. We don't know all the nuances that they have to deal with. So we, like, for example, if I'm saying that, at all time, for let's say going back to the St. Clair College example, when we are saying you have to make sure that every student who is sitting in a class have a 2 meters distance in between them. How they do it, how they spread the class, what kind of structure that they want, what kind of, whether they're using a plexiglass, whether they're using a desk, whether they're using like a big room or a small room, that's entirely up to them. So what we are focusing is, doesn't matter where the classroom is, make sure you have 2 meters distance. Make sure you have a hand sanitizing station at the entrance of the room. Make sure you have like a path to come in and another path to go out, so there is less interaction. There's nowhere in their pathway where they're coming into the class an opportunity for them to congregate. They just have to come in, take the class, and leave. There is no opportunity for them to socialize or do this thing. If they have any kind of a cafeteria or something where people have the opportunity to congregate, we're saying, no, shut it down. We don't want that. We don't want them to congregate. So those are the kind of high-level things that we provide our recommendations, and touching on the key aspects of what is the screening process, what kind of PPE is being used, what kind of physical distancing, and all these measures are being used.
Okay, thank you for the clarification. Have a good day.
No problem. Thank you.
Thank you, everyone.
Thank you.